Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Then we have 5HT2. 5HT2 is further divided into 5HT2A, 2B, 2C. So this 5HT2 is GQ type, which increases the IP3DAG pathway. This 5HT2 5HT sites 5HT2A is present in the platelets, it is present in the smooth muscle and also cerebral cortex, whereas 5HT2B is present in the stomach fundus of the stomach, whereas 5HT2C is present in the choroid, in the eye, or it is present in the hippocampus, choroid and substantia nigra. Here we see 5HT2C. Then the treatment is this 5HT2 will cause vascular and visceral smooth muscle contraction. It causes vascular and visceral smooth muscle contraction. It causes platelet aggregation. Then it results in neuronal activation of the brain. It causes neuronal activation of the brain. Ketanserin will block these receptors, and thus it is used in, so all of this is used in the pathogenesis of anorectic hypertension.
thank you and thank you for watching.